Hello, everybody. At 30 seconds, a woman comes on and she gives the definition of what is counted as a COVID death. So you tell me what the definition of a COVID death is and how they're counting all these people. Here you go.
Earlier this week, the state reported the death of a teenager in Cook County. Are you familiar with this case? If so, is this the state's first teenage death? And can you tell us if the teenager in question had underlying conditions?
I don't have that information at my disposal at this time. I know we have had people of all age groups die. I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
You heard her. Even if you clearly died from another cause, if you happen to have been infected with COVID at the time, it's counted as a COVID death. So of those 300,000 deaths in the USA right now, you tell me how many are really caused by COVID and how many were caused by an alternate factor.